The floaty things in your eyes, understanding eye floaters. Have you ever noticed specks or squiggly lines drifting across your field of vision, seemingly out of reach? These seemingly elusive, floaty things are known as eye floaters. And they are a common occurrence that many people experience at some point in their lives. While they may appear to be a cause for concern, eye floaters are typically harmless and are often a natural part of the aging process. In this video, we'll explore what eye floaters are, what causes them, and when you should seek medical attention. What are eye floaters? Eye floaters, also known as vitreous floaters or simply floaters, are specks, dots, or squiggly lines that appear in your field of vision. They can take on various shapes, sizes, and colors, but they are typically described as dark or semi-transparent. These floaters move as your eyes move, and when you try to focus on them, they tend to dart away. Eye floaters are not located on the surface of your eye but are suspended within the vitreous humor, a gel-like substance that fills the back of your eye. The vitreous humor helps maintain the shape of the eye and allows light to pass through to the retina, where images are processed and sent to the brain. What causes eye floaters? The primary cause of eye floaters is the natural aging process. As we get older, the vitreous humor in our eyes becomes less viscous and more liquid. Additionally, the collagen fibers that make up the vitreous can clump together and cast shadows on the retina. These shadows are what we perceive as floaters. However, eye floaters can also result from other factors, including 1. Eye injuries. Trauma to the eye can lead to the development of floaters. 2. Eye conditions. Certain eye conditions, such as retinal tears or detachments, can cause floaters to appear suddenly and require immediate medical attention. 3. Inflammation. Inflammation in the eye, known as uveitis, can lead to floaters. 4. Vitreous detachment. Sometimes, the vitreous humor can separate from the retina, causing floaters. While this is usually harmless, it can be associated with a risk of retinal tears. 5. Medical conditions. Certain systemic medical conditions, like diabetes, can increase the risk of developing floaters. When to seek medical attention. While most eye floaters are harmless and don't require medical intervention, there are cases where you should consult an eye specialist, ophthalmologist, immediately. If you notice any of the following, it's essential to seek prompt medical attention. 1. Sudden onset of a large number of floaters. A sudden increase in floaters, especially if accompanied by flashes of light, could be a sign of a retinal tear or detachment. 2. Change in the character of floaters. If your floaters change in size, shape, or intensity, it's a reason for concern. 3. Eye pain. If you experience eye pain or redness in addition to floaters, it may indicate an underlying issue. 4. Loss of peripheral vision. A sudden loss of peripheral vision can be a symptom of a retinal detachment. 5. New floaters after eye surgery or injury. If you've recently had eye surgery or suffered an eye injury and notice new floaters, consult your eye doctor. In most cases, eye floaters are not a cause for alarm and do not require treatment. Over time, you may become less aware of them as your brain adapts to their presence. However, if you have concerns or experience any of the warning signs mentioned above, it's essential to have your eyes examined by a qualified eye specialist. Eye floaters are a common and usually benign occurrence for many people, often associated with the natural aging process. While they can be distracting, they typically do not require medical treatment. However, it's important to be vigilant and seek immediate medical attention if you notice sudden changes in your floaters, flashes of light, or other concerning symptoms, as these may indicate underlying eye conditions that need prompt treatment. Regular eye exams are also crucial for maintaining overall eye health and catching any potential issues early. Medical conditions that can increase the risk of eye floaters. While age-related changes in the vitreous humor are the primary cause of eye floaters, several medical conditions can also contribute to their development. If you found value so far in this video, please give it a thumbs up, like and subscribe to support this channel, it will be appreciated. Please share across social media platforms to reach a wider audience. Understanding how these conditions relate to eye health and the potential risks they pose can shed light on the Importance of regular eye examinations and seeking medical attention when needed. 1. Diabetes. Diabetes is a systemic condition that affects blood sugar levels and can lead to a range of health issues, including eye problems. Diabetic eye conditions like diabetic retinopathy and macular edema can cause changes in the blood vessels of the retina. These changes may lead to bleeding, inflammation, and the release of debris into the vitreous, which can manifest as floaters. Regular eye exams are crucial for individuals with diabetes to monitor and manage any eye-related complications promptly. 2. Posterior vitreous detachment, PVD. This is a common age-related occurrence where the vitreous humor, which is normally attached to the retina, gradually separates from it. As the vitreous detaches, it can create small clumps of vitreous gel or collagen fibers that cast shadows on the retina, leading to floaters. While PVD is often benign, it's important to consult an eye specialist if you experience a sudden onset of floaters, as this can sometimes be associated with a risk of retinal tears or detachments. 3. Inflammation and autoimmune diseases. Inflammatory eye conditions like uveitis and autoimmune diseases such as rheumatoid arthritis, lupus, or Behçet's disease can increase the risk of eye floaters. Inflammation in the eye can release cells and debris into the vitreous, which can result in the perception of floaters. Managing the underlying condition is essential to reduce the risk of complications. And regular eye exams are essential for monitoring any changes in eye health. 4. Eye injuries and trauma. Physical injuries to the eye can lead to the development of floaters. Trauma can cause bleeding inside the eye, which may result in the release of blood cells or debris into the vitreous humor. This can manifest as floaters, and while they may resolve over time, it's important to consult an eye specialist to assess and address any damage to the eye caused by the injury. 5. Systemic hypertension. High blood pressure, or hypertension, can have systemic effects on the body, including the blood vessels in the eyes. Hypertension can damage the small blood vessels in the retina, leading to bleeding, inflammation, and the release of debris into the vitreous humor. This can contribute to the appearance of floaters. Managing blood pressure through lifestyle changes and medication, as prescribed by a healthcare provider, is crucial to reducing the risk of eye complications. Regular eye examinations are vital for early detection and management of these conditions, as well as monitoring the presence of floaters. A comprehensive eye exam can help ophthalmologists identify any underlying issues and provide appropriate treatment. While most floaters are harmless, seeking medical attention when necessary ensures the best possible care for your eye health and can prevent more serious eye conditions from developing. Remember, early intervention is often the key to preserving your vision and maintaining your overall eye health. Treatment for eye floaters largely depends on the underlying cause and the severity of the symptoms. In most cases, eye floaters are harmless and do not require medical intervention. However, if they are causing significant visual disturbances or are a result of an underlying eye condition, treatment options may be considered. Here are some of the treatments available for eye floaters. 1. Observation. In many cases, eye floaters are benign and may become less noticeable or bothersome over time, as your brain adapts to their presence. For these instances, no specific treatment is necessary, and your eye doctor may recommend regular eye exams to monitor any changes in your eye health. 2. Vitriolysis. This is a non-invasive laser procedure that can be used to break up floaters in the vitreous humor. A special laser is used to target and vaporize the collagen or protein clumps causing the floaters. Vitriolysis is generally considered for cases where floaters significantly interfere with vision, but it is not suitable for all types of floaters. This procedure is relatively new, and its long-term effectiveness is still being studied. 3. Vitrectomy. Vitrectomy is a surgical procedure in which the vitreous humor is removed from the eye, and a saline solution is used to replace it. This procedure is typically reserved for severe cases of floaters that significantly affect a person's quality of life, or are related to other eye conditions like retinal detachment. Vitrectomy carries certain risks, including the potential for cataract formation and retinal complications. so it is considered a more invasive option. 4. Medication. In some cases, floaters may be associated with underlying eye conditions, such as inflammation or infections. In these instances, treating the underlying condition with medication may help reduce or eliminate the floaters. This treatment approach is not directly aimed at the floaters themselves but rather the root cause. 5. Diet and lifestyle changes. Maintaining a healthy lifestyle, including managing conditions like diabetes and hypertension, can help prevent the development of floaters or reduce their severity. This includes managing blood sugar levels, blood pressure, and maintaining a balanced diet. It's important to note that any treatment for eye floaters should be discussed with and prescribed by a qualified ophthalmologist. Self-treatment or attempts to remove floaters without professional guidance can lead to complications or worsen the condition. Moreover, it's essential to understand that treatment for floaters is typically considered when they significantly impair vision, or are associated with other, more serious eye conditions. Most individuals with occasional floaters do not require medical intervention and can learn to live with them. If you are experiencing new or severe floaters, or if they are accompanied by other symptoms like flashes of light, sudden vision changes, or eye pain, it's crucial to seek immediate medical attention, as these could be signs of more serious eye conditions that require prompt treatment. Regular eye exams are also important for monitoring your eye health and addressing any concerns related to floaters or other eye issues. If you enjoy this video, please give it a thumbs up, like and subscribe to our channel for more self-improvement videos. Comment below to tell us how useful you found this video. Don't forget to share on various social media platforms to reach a wider audience. Click the notification bell to get notified anytime we post a new video. Thanks for watching, see you in the next video.